Hello everybody. I am so tired. I'm just praying that God gives me the strength to just go over or to get this video done like well. Okay, as promised, I said I was going to talk about the chambers of the heart, or specifically the ventricles, like what could go wrong with the ventricles. So, the thing that can go wrong with the ventricles, let's say, like for example, the stenosis of the left, stenosis of the left, um, of the aortic valve. There's like a lot of fluid inside a ventricle, causing dilation of the ventricles. So that's just an example. I think I mentioned the example in the last video. So what could go wrong is ventricular hypertrophy. So there could be like the muscle, too much muscle, due to the fact that let's say if there's stenosis of the aortic, I'm getting tired. Let's say the stenosis of the aortic valve, blood from the lungs will come and accumulate and cause like a lot of blood to pool. Therefore that ventricle will have to like push so much blood, causing ventricular hypertrophy. Okay, so what do I have? Ventricular hypertrophy, or the other one that we could have is dilation of the left ventricle. Okay, but we can have left ventricular hypertrophy or right ventricular hypertrophy, but left ventricular hypertrophy is the most common one. Hypertrophy of the ventricle is like very, very dangerous, like deadly, and it's usually like very genetic, and it's seen in, like, let's say there's like a young healthy man who's playing soccer and all of a sudden like falls and dies. So if somebody has like a ventricular hypertrophy, like we already talked about, they are at risk of heart failure. Like it's really bad. So they are candidates for implants, like a heart implant. They are risk. They can also get like ICDs, which are also kind of like, it's not a pacemaker, but it kind of stops like really bad dysrhythmias. They can also get VADs, which kind of works like a VAD kind of like works like as an artificial ventricle for the heart. The difference is that it also kind of like can filter the blood and send in oxygenated blood to the body. Yeah, so when it comes to the ICDs can actually cause bleeding. That's one of the complications. And with bleeding, we're going to see signs and symptoms of like low urine output, like shock, for example, low urine output. What's the other one? Tachycardia, like really high heart rate. Tachypnea, really high breathing. Hypotension due to the hemorrhage or the bleed, and a weak pulse because there's not enough blood going towards the extremities. We might even hear crackles in the lungs. Let's say like the blood is pooling, but it's like not going out, as in it's not pushed out to the rest of the body. It's backing up into the lungs. So also, hypovolemia can cause that. So with ICDs and pacemakers, we talked about pacemakers in the last video. ICDs can cause pericarditis, and pericarditis is pretty much inflammation of the pericardium layer of the heart. And pericarditis, one of the hallmark sign of a pericarditis is a pericardial friction rub. Yeah, that's what you would hear. And we can also see like paradoxus, pulses paradoxal, where the systolic, as you're breathing in, the heart rate is gonna go up. Your systolic blood pressure, I believe, will go up, but I know the heart rate will go up because due to the pressure in the chest. Pericarditis too can lead to cardiac tamponade, and some of the signs and symptoms of cardiac tamponade. First, what is cardiac tamponade? It's pretty much like fluids around the heart, like, due to like, irritation and inflammation of the pericardium. There's something called the Beck's triad, which is like the hallmark signs of cardiac tamponade, and it includes jugular vein distension, muffled heart sounds, and hypotension. But some of the other symptoms you might notice is like tachycardia. You might notice, obviously because it's hypertension, so tachycardia. You might notice, what's another thing? Usually if you're going inside the chest, like to do surgery, you have a chest tube. So if you notice that there's no output in the chest tube, it might be in the pericardial space. Yeah, and we're gonna treat it with a pericardiocentesis. What does that mean? Like they'll go into the pericardial space and remove some of the fluids. Another thing we can do too, as in to diagnose and to see what's going on, I think there's a word for this that I forgot. I need to look that up. I think it's called I forgot. I'll look it up. But yeah, but it will use a Schwann-Ganz catheter to kind of check like the pressure in your heart and see, like, check the hemodynamic status. So this Schwann-Ganz catheter will let us know about cardiac output, like how effectively is your heart able to pump blood, stroke volume, how much of the blood is actually being pumped with each beat. What's the other one? It can check CVP, which is, I don't know what it stands for. I gotta look that up now. But basically it looks at your right atrium, the right side of the heart, central venous pressure, looking at your right side of the heart in the atrium to see how much blood is there. And then we have pulmonary wedge, which will let us know the amount of blood in the left ventricle, and pulmonary artery pressure will tell us about the pressure on the right side, the left side of the heart, right? Yeah. So that is really that. So yeah, indications for like an ICD will be low ejection fraction, like lower than 35, whatever, because normal is usually 55 to 70. It's around that, don't quote me, but something like that. Or so like low ejection fraction or cardiomyopathy are the two main things that they look at before they'll say you're gonna use the ICD pacers. And I feel like I should talk a little bit about the ICD pacers. ICD pacers are not like, ICDs are not pacers, but ICDs might be put in with a pacer. What ICD does, it stops really, really bad dysrhythmias, like it will shock you. And if a person has this ICD, I need to go in, so they would have to like open the door. Let's say like they notice that it's about to come, they need to call 911, open the door and lay on the floor, just so for safety. That's what they need to do. And yeah, the ICD initially, when you do your surgery, sometimes the ICD might not be available, so you might have to wear like a vest. I don't have it on this paper either. And the vest can only be worn, the vest has to be on all the time. It can only be taken off when you're showering, and the battery also has to be changed daily. And the thing with cardiomyopathy too, they can do a heart transplant. They are really good candidates for a heart transplant. The problem with the heart transplant is, again, it's prone to rejection. Rejection. So they will have to be on like tacrolimus. I can't think of like what they are really right now, but yeah, corticosteroids and yeah, all of those drugs that I gotta go back and look at. Yeah, so, and the problem with like the heart transplant is that the heart that has been transplanted doesn't have any nerve endings on it. Therefore, if a person has actually if a person has an ischemic attack or an infraction, meaning lack of oxygen to the heart, or a complete dead heart, not a dead heart, a completely injured heart, the person will not know and they might just collapse and die. There's higher chance of atherosclerosis, which is like basically fat inside the blood vessels of the heart, which might lead to ischemia and heart attack. Also, there's high chance of high cholesterol levels in the body with this heart or inside the heart itself. I think I just said that. Weight gain, I'm sorry. And yeah, so, and we wouldn't be able to also find the pulse with this heart transplants. We wouldn't be able to find a pulse. So you can see how, how hard this is. I think I would have to go and look up, or I did heart transplant twice. I think I will have to go and look up if we can do like CPR on the heart transplant and all of that. But that is pretty much it. I don't know if I talked about a VAD. But yeah, I am tired. That is it for the video. Thanks for watching. I think I'm gonna go take a nap, and I'll look for those questions about the CPR with heart transplants. Thanks for watching my video. Bye. I am exhausted.